winter fast approaching, we're headed into what many deem to be the most wonderful time of year. The upcoming holidays give friends and families a reason to come together, sharing food, gifts, and memories from the past year. But intertwined with this joyful season is a much less welcomed experience. The fall and winter months are notorious for an uptick in pan-respiratory viruses like RSV and the flu.
It's typically the viruses that come around when we tend to congregate, spend more time, and seasonally spend more time together inside, and they tend to do better in colder environments. COVID being one of the newest of which that made a big splash on the scene.
That's Dr. Eric Griggs, Associate Vice President of Community Health Affairs at Access Health, Louisiana. Pan-respiratory viruses spread through particles that an infected person expels when coughing, sneezing, or simply breathing. While anyone can catch it, older adults, infants, and people with chronic conditions are most at risk to have a severe case. Griggs says it all comes down to many people in these groups having compromised immune systems.
Immune compromise means your body can't function fully to protect yourself. If you have chronic conditions like diabetes, if you have chronic conditions like hypertension, if you have lung disease, COPD, and asthma, if you are age 65 and older, or you're a child or infant, the extremes of our society, the babies, their immune systems haven't fully functioned, right? So they have weakened immune systems relative to a healthier young adult.
And as we age past 65, our body's ability to defend itself begins to be less and less effective. And for these populations, getting hit hard by an illness means more than just missing a couple days of work. Catherine Hicks, an executive director of health economics at RTI Health Solutions, says that complications from diseases like respiratory syncytial virus go beyond health. Her 2023 study, published in the Journal of Infectious Diseases, digs into the economic burden of RSV for older adults in America.
Just in that 60-plus age group, there are 4 million RSV cases annually per year in the U.S., and about a quarter of those are medically attended. So 3/4 of people deal with it at home. From that, we also have hospitalized cases. We estimated around to be 173,000 hospitalized cases come out of that. And then 8,200 deaths as well. And there's some research that shows that more than half of people who experience RSV had symptoms that kept going after the acute illness. So that's really a large number that we see. And also about 1 out of 7 hospitalized people who are hospitalized for RSV end up requiring moving to a higher level of care.
The team took into account both direct and indirect costs that come with having RSV. The direct costs were made up of healthcare expenses such as patient care and hospitalizations.
We estimated that to be $2.9 billion per year. But what's really interesting about that, so 94% of that number was due to the 4% of RSV cases that were hospitalized, right? So it's a small sliver. A lot of those costs are driven by those hospitalized cases, which is a small portion of the cases, but that's what drives those costs. There are other costs that we considered in terms of outpatient costs and ED visits as well, but those were really just the remaining 6% from that.
On top of the nearly $3 billion a year in direct healthcare expenses, Hicks also calculated the indirect costs. These include productivity losses from being sick and missing work, as well as the loss from premature deaths caused by the virus.
From that, we actually found that those indirect costs were higher than the direct costs at $3.7 billion over the 2.9 indirect costs. So those indirect costs ended up being the total cost we estimated was $6.6 billion.
Hicks says a fairly large portion of the indirect losses is from premature deaths due to RSV. Her goal for these findings is to help inform the policy decisions around RSV prevention and care. The U.S. recommendations for vaccines come from the Advisory Committee on Immunization Practices, or the ACIP. The FDA approved the first vaccine for RSV in 2023, so the ACIP's recommendations followed soon after.
And they recommended at that point that adults age 60 years and older receive an RSV vaccine on the basis of what is called shared clinical decision-making. So what that means is that the doctors, the physicians, and the patient decide together whether it's appropriate for that patient to get. So there was a lot of discretion, clinical discretion in the decision. So that was the recommendation that was in place when our paper came out in December, this one that we're talking about. However, this past June, so about a year later, they modified that recommendation so that ACIP now recommends a single dose of RSV vaccine for all adults 75 and older, and also for adults who are 60 to 74 who are at increased risk for severe RSV disease.
The CDC has a full breakdown of who falls into that category on their website. It includes adults with chronic heart disease and those who live in nursing homes. But even with the updated recommendations, the CDC estimates that just over 36% of all adults 75 and older have ever received an RSV vaccine. Griggs says a big reason for vaccine hesitancy is the amount of distrust Americans have in public health organizations, which partly stems from the mixed messages put out during the pandemic.
My job in front of, I don't know how many thousands and millions of people every day, was to explain that science is not a perfect, you're seeing how the sausage is made. So one day we might tell you to do this, the next day it might change because we found something that was earth-shattering and it will make a difference.
And though there was a lot of discussion about the best practices to protect Americans from the virus, vaccines themselves were not a new concept.
In the world of public health, vaccines have been some of the most transformative that we've found in the world, and most of them serendipitously. They've been around for a long time. We know that they work. People don't even realize they're protected because they first exposed to vaccines when they are newborns. I'm going through that now. A lot of times what happens is we tend to doubt those things that we don't see. Because vaccinations have been so successful, like with smallpox, people tend to forget that it even exists. And they forget the cause and the reason that they disappear. So again, we tell you that science does evolve and say, in the meantime, take the vaccinations that you know we trust and know this will work.
The CDC estimates that there were between 17,000 and 100,000 flu deaths between October 2023 and April 2024. For RSV, the American Lung Association reports that up to 10,000 older adults die each year. Many of these deaths might have been avoided with the right prevention tactics. And though infants and older adults are the groups we most often focused on, Hicks doesn't want us to forget about the rest of Americans. Part of her research also looked at the age groups in between, such as 18 to 49 and 50 to 59. While the economic burden on these populations was less, it's not something to completely ignore.
So we were looking at only hospitalizations in those groups, the 50 to 59, 18 to 49 with risk factors. So 50 to 59, there was $1.1 billion in societal costs, direct and indirect, for those 50 to 59-year-olds. So those are people that are outside of the recommendations. And people with risk factors, 18 to 49. So we found a high burden in people with the highest total burden in people with obesity, which that was $358 million a year. Per capita, people with congestive heart failure incurred the highest cost per capita among those groups. But the point is, there is still a significant burden among these groups that are younger.
The ACIP doesn't have any current recommendations for these age groups, but Hicks says they're starting to have these conversations. Even for people not at a high risk for severe cases of respiratory viruses, proper protection can help minimize the annoying sick days filled with boxes of tissues and nasty coughs. While it may be a nuisance, the data shows that these measures work if you're looking to avoid a run-in with viruses.
For the last 5 years, especially, if you remember during the pandemic, the numbers for the flu, the numbers for RSV, at one point they were had disappeared because everyone was taking the proper precautions. You know, the Department of Health and Human Services has a campaign that says risk less, do more. And it's one that's happening throughout this respiratory virus season, this pan-respiratory virus season, to encourage people to get vaccinated. People are starting to realize the importance of vaccinations, that these are viruses and they're usually self-limited, which means that they will run their course over time, typically 1 to 2 weeks, and you'll tend to feel better. But vaccines can make you feel less sick.
You can find more information about Dr. Eric Griggs, Catherine Hicks, and all of our guests on our website, radiohealthjournal.org. For more behind the scenes, follow Radio Health Journal on Facebook, Instagram, and X. Our writer-producer is Kristen Farah. Our executive producer is Amira Zaveri. I'm Elizabeth Westfield.